Good evening. My name is Misty Campbell, RN. I will be conducting the post-fall huddle on Miss Ebony in room 111. We have the interdisciplinary team present. We have the patient and family. We have myself, the certified nurse assistant, the physical therapist, and the social worker all present. Miss Ebony did sustain a fall since admission. Her Morse fall scale score reveals a total score of 55. Since she has a history of falling, she did get a score of 25 for that. And also because she's using the ambulatory aid, she did get 30 for that with a total of 55. So with that being said, we're going to go over the contributing factors for the fall. Miss Ebony is an 86-year-old female with falls at home, syncope, and dizziness. She's also receiving IV fluids, which may contribute to the use and the need of using the bathroom more frequently. She was ambulating without assistance to the bathroom at the time of the fall. At this time, we can do an update to her care plan to include at risk for falls related to syncope. The outcome would be that the patient will not sustain any injuries related to falls during this admission. And interventions that we can use are she's to wear the non-skid socks at all times versus keeping them in the bedside nightstand. So if she's wearing them at all times, she does not pose a risk for, needing to put them on prior to ambulating. We also will have physical therapy evaluate the need to use a bedside commode. I do believe that she can benefit from the use of a bedside commode since she's able to, safely ambulate with a steady gait. She will just, transfer from the bed to the bedside commode. Also, we're going to have the certified nurse assistant toilet Miss Ebony every 2 hours with every care rounds or offer toileting even if she doesn't necessarily have to go. We will keep the call bell in reach at all times. We'll keep frequently used items in reach so that she's not reaching or overreaching, possibly creating a fall risk for that. We will have the pharmacy do a medication reconciliation to see if any of her medications are contributing to the fall. We can also have the provider do a medication review or, review her records for any contributing factors that could be causing the falls. The social worker will also include the risk for falls, in the discharge planning. We can possibly have home health do visits after discharge, just to make sure that she's not, having any fall hazards at home. We also can possibly discharge Miss Ebony to home with outpatient PT/OT, again, in hopes that we can prevent any further falls. At this time, I would like to ask the patient and the family if they have any questions, any suggestions that they can pose to us that we can possibly make this a safer stay here for Miss Ebony. Also, we will make sure that Miss Ebony has, all fall precautions in place. The fall wristband will be on. Her chart will be flagged for fall risk. We will actually try to see if we have maybe a room that's closer to the nurse's station so that we can keep a better eye on her. make sure that there's adequate lighting in the room, and make sure that the room is free of any clutter to prevent any future falls.